Chapter 13. The Overseas Doctor. A. Type of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council (GMC). There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area (EEA) member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training (CCT). The GP register is a register of all those eligible to work in general practice in the NHS. B. PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure that those who pass can practice safely at the level of a SHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective structured clinical examination, OSCE. It consists of 16 5-minute clinical scenarios, known as stations, to assess professional skills. C. PLAB stations and advance. OSCEs assess these skills. Clinical examination. Your ability to carry out a physical examination of a simulated patient. An actor trained to play this role will be assessed. Uncomfortable or intimate examinations will be carried out using a magnetic anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient or in some cases the examiner will be assessed. Skills tested may include breaking bad news and giving advice on lifestyle. History taking. Your ability to take an accurate history and make a recent diagnosis will be assessed. Advance on the stations from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Keep in mind safety precautions like throwing the sharps in the sharp bin. Don't forget the ABC, airways, breathing, and circulation protocol in every emergency station. Check the patient understands what is happening. Then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what the actor says. 13.1 What kind of registration might these doctors obtain? 1. A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully complete the first foundation year, F1, full registration. An ASHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registrar posts. Specialist registration. 13.2 Write the abbreviations in words. Any doctors who want to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLB test before they can register. Professional and Linguistic Assessment Board. Part 2 of the test consists of a OSCE, Objective Structured Clinical Examination. In any emergency, remember the ABC protocol: airways, breathing, circulation. 5. Before you can obtain a specialist registration, you must have a CCT, Certificate of Completion of Training. 13.3 Complete the text. Look at A, B, and C opposite to help you. My name is Musa, and I come from Yemen. I came to UK about 2 years old after graduating. Because Yemen is outside the EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling station you shouldn't simply memorize a set of phrases. It's better to really think about that you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialty, pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain CCT, which will allow me to proceed to specialist registration with the GMC, an important step on the road to becoming a pediatric consultant.